Hey, I'm Dr. Chris Rouse with Flatrock Family Dentistry. Good to see you. A lot of patients have questions about dental crowns, so I thought I would answer some of the most common questions for you. One of the most common questions we get is, what is a crown? What is a dental crown? A crown is, I think of as like an enamel replacement. So you have a tooth that has the hard enamel shell that protects your tooth. A crown is basically replacing that protective part of your tooth. It's almost like a helmet that you put over the tooth so that it doesn't crack or break. An alternative to a dental crown is a huge filling. You don't rely on fillings long term if they get really big because there's not a lot of supporting tooth structure to help support that filling, and the tooth tends to break. You can do very large fillings as a first step to restore a tooth, get rid of cavities, bonding, cracks, and so forth. But typically once a tooth structure is compromised enough to be confident that you can use it a long time, you would need to place a crown on it to protect it. What types of dental crowns are out there? There's a lot of different materials that you can use for a dental crown. For children, they just come stock. You take them out of a box, they're already pre-made, they're made out of stainless steel, and you find the one that fits the closest and you reshape the tooth and glue it on there. That's used for children because it's cheaper and it allows them to function on it, and we're not really trying to have that last very long. It just needs to last until that baby tooth falls off. For adult teeth, which is when we're typically doing crowns, we have all metal, which would be like an all gold crown. We have some crowns that are a metal with a porcelain fused to the outside. It's called a porcelain fused to metal. And so usually that would have a metal substructure, a metal base with porcelain baked on the outside. There are all porcelain crowns. Those are probably about 90% of what we do are all porcelain crowns. And there's a lot of different materials you can use. We use a lithium disilicate mostly, brand name Emax, and it's a very strong material. It's about twice as strong as regular enamel. That's probably the most typical crown that we would do is a lithium disilicate or an Emax all porcelain crown. Is a crown needed after a root canal? If it's a back tooth, so you have your front 6 teeth, which we consider your front teeth, and then everything behind that is a back tooth. So if it's a back tooth that has had a root canal, and if you don't have a crown, there's almost 100% chance that you would lose that tooth over time. The reason being, when the root canal is done, it hollows out the middle of the tooth and weakens it. So a crown kind of goes over the top, it kind of hugs the tooth, and gives it strength so that as you function over time, it doesn't split. Almost all back teeth will crack or split over time if you don't place a crown on them. On a front tooth, if there's a lot of tooth structure left and the root canal is done in a way where it can be, it was conservative, then a lot of times you don't need to do a crown on the front teeth after a root canal. You can seal that up with a filling. A lot of people want to know about the crown procedure. What is it that we do? Obviously, we have you come in, we get you numb so you're comfortable. We have to use some kind of model for the tooth. So sometimes we will take pre-op impression or we'll scan the tooth to get the current shape of your tooth. The tooth is made the right shape. If there's a cavity in the tooth or an old filling that isn't good, we'll remove that and make sure that there's a healthy base of the tooth. Often we'll have to create a foundational filling that we place inside the tooth to help make the tooth the right shape for retention and strength. After the tooth is the right shape, we would most often take a 3D scan of the tooth, and then we're either going to be designing that in lab here, or we send it to a lab depending on what we need to do. Most often a temporary crown is placed on the tooth that you'd function with for like 2 to 4 weeks, depending on how long we need to get it back from the lab. When you come back, we take off the temporary, place on the more permanent or long-lasting crown, make sure that the fit is right. We do several steps to ensure the quality of the fit. Obviously visually, we're checking things in the mouth. We check with a radiograph to make sure the fit is good there. And then we check after we seat the radiograph to make sure that it's still fitting well and that we've cleaned up all the cement properly. Clean the tooth really well before cementing the crown. So there's a lot of extra steps I feel like we do to ensure the quality and the fit of the crown, so it'll last for you. Some people ask about same-day crowns, same-day dentistry with crowns, and we do have that ability here at Flatrock Family Dentistry. It's pretty cool. The day of the appointment, you come in and we will get you comfortable. We'll numb the area, make sure that the tooth structure that is there is healthy. If there's an old filling that isn't functioning well, or there's a cavity in the tooth, we remove that, make sure it's all healthy. Sometimes we'll build up that tooth with a foundational filling to make the right shape, have the right retention for the crown. And then we scan the tooth. We have a 3D scanner that creates a 3D model of your tooth, and we can design it digitally and send that model to the mill. We have different solid blocks of lithium disilicate, which is EMAX. We have many different shades to pick from as a base color, and we will mill the crown out of a solid block of lithium disilicate. We ensure the fit. We can polish the crown, or we could add custom color to it if there's characterizations that we need to put on the tooth. And we glaze the crown and put it in a furnace, and it cooks it, and it turns it hard and makes it so you can function on it. And then it's your crown, and that's all done in the same day. So some people ask, does it hurt when you have the crown placed? So let's say you've been in a temporary crown and you're coming back for the delivery. So I would say probably about 30% of our patients get numb at that appointment. The other 70% don't. We just make sure that you're comfortable. So if you need to be numb, we numb you. If you're totally fine without it, then we don't need to numb you. But it should not be a painful process. We clean the tooth well. We make sure that the fit of the crown is excellent and the function is proper, and then we deliver the crown for you. I hope this has been helpful in helping to understand more about dental crowns. If you have any additional questions, or if you'd like to schedule an appointment for a crown, please give us a call at 864-297-5268. We're here to help.